Many of you may be saying, come on, steady, there's no need to panic. Why am I saying this when we've so far had just 5 deaths and all very elderly people? And you're right, in a way. There's no need to panic. Our health officials think this is a virus that kills only 1% of people who get sick.
For children and for young adults, the death rate is extremely low, and the serious illness in those age groups is also very rare. However, for people in the older age groups, and I would include myself in that, so people over the age of 60, they are more susceptible to this disease, and we are finding particularly in the much older age groups, 80 and above, that the death rate is actually quite high.
In fact, people over 80, the death rate there is actually over 20%. As for the young, well, it doesn't mean that it's okay for you to go out and party. I mean, who cares if you get sick? You'll recover anyway, feels like a mild cold. Yes, but do that and you might also pass on the virus and kill your parents or your grandparents or some poor schmuck you infected while you were at the shops or on a train.
Don't just think of yourselves and your own family, but you could unintentionally be infecting and causing the death of so many other people. We do know that our older people in particular are very vulnerable to this disease. This is life and death. Don't take chances.
But here is the big reason to worry. On Saturday, the number of new cases of people with the virus in Australia exploded by 30%. Yesterday, it jumped another 23% in a day. So as of this morning, we had 313 people who've been affected. That is an incredible rate of spread. And think how fast that is. I did the maths. Let's assume that we keep this infection increase to just 20% a day. In just 3 weeks, we would then have not the 313 cases of today, we would have more than 14,000, with thousands more sick people every day. And that is even before the winter flu season hits. That's what's terrifying our medical experts. Or put it this way, just 3 weeks ago, Italy had just 7 deaths, about what we've got ourselves right now. Today, it's got 1,800 people dead. In fact, Australia's Deputy Chief Medical Officer predicted that more than half of us could get this virus. He said somewhere between 20 and 60% of all Australians will get sick, which in fact means anything up to 15 million of us get a virus that kills 1 in 100. Do the maths. And we're already now running out of protective gear and of testing kits, particularly for the frontline people, the doctors, which is why, running short of medical testing kits, is why doctors now will treat or test people only if they seem sick or at most risk. So, will our hospitals then cope with the surge in cases that will come if we don't stop this spread now? It is critical that we flatten that peak so that we do have, hopefully, enough intensive care beds and equipment to keep the sickest alive. And that's why our federal and state governments agreed on Friday to ban public gatherings of more than 500 people, unless it's, say, for work or for school. And people flying in from overseas, as of last night, must go into 2 weeks of isolation. And state governments, well, they today backed all that up with emergency declarations so that in Victoria, for instance, you could be fined $20,000 if you are supposed to be quarantining yourself, but you decide to duck out to the shops or to the pub or for a quiet meal in a restaurant.
Under the state of emergency that has been declared, it is an offence under the Public Health and Wellbeing Act to not comply with the orders that have been made.
Now, workplaces, shops and restaurants can still stay open. There's a bit of debate about that. Trains and planes can still fly. I guess we can't kill the economy just yet. But the Prime Minister today flagged that further restrictions are coming, probably to smaller or closed meetings, even weddings.
The National Cabinet will meet again on Tuesday evening, and they'll be providing us advice on aged care facilities and visitation arrangements there and restricting those. They'll also be providing us with further advice on enclosed gatherings. Now, that's something they've been working on, but these are practical sort of measures as well, and they need to be well thought through, and that's what they're doing. But I want to stress something, Laura, and that is these are not absolute measures. I mean, you cannot close off every single possible risk.
As for schools, they can stay open, but only for now. The theory is that closing them means that kids might not stay at home anyway, or they might get looked after by their grandparents who could get really sick. And a lot of nurses and doctors with children might have to stay at home to mind them, and we cannot afford that. But I do think schools will close at some stage, particularly if or when a lot of industries are shut down, or suburbs or towns go into lockdown, and the parents have got to be at home anyway. Because let's face facts, if this coronavirus keeps spreading this fast, you've seen nothing yet.